Hi, my name is Kristie Kokeny. I'm one of the physician assistants here at Urology Associates, and I'm in charge of the prostate cancer clinic. Today we're going to be discussing a Gleason score and what that means. What the Gleason score is it's how we grade aggressiveness of your prostate cancer. The way that we come up with that score is all of your tissue samples that were retrieved from your biopsy are sent to a pathologist for them to review. They look at each one individually under the microscope and they ask themselves two questions. Number one, is there prostate cancer here? Yes or no? And number two, if the answer is yes, how different do these prostate cancer cells look from normal, healthy prostate cells? And that's how they come up with the Gleason score. The Gleason score was arbitrarily chosen to go from 6 to 10, with 6 being the least aggressive type prostate cancers and 10 being the most aggressive type prostate cancers. Gleason 7 and Gleason 9 are further subdivided. There is essentially a Gleason 3 plus 4 equals 7 prostate cancer and a Gleason 4 plus 3 equals 7 prostate cancer. All that means is that a Gleason 3 plus 4 prostate cancer is going to be more similar in behavior to a Gleason 6 prostate cancer than a Gleason 8. And 4 plus 3 prostate cancer is the exact opposite. Generally speaking, if you have Gleason 4 plus 3 disease and above, you will have staging imaging done to ensure that there's no spread of disease outside the prostate gland, and that is done with a PSMA PET scan. The Gleason score doesn't directly signify metastatic disease or not. It more so sorts the disease into low grade and high grade. So Gleason 6 and Gleason 7s are considered low grade disease, which in general is slower growing, less aggressive, less likely to spread outside the prostate gland. Gleason 8 through 10 is considered to be high grade disease, more aggressive, faster growing, more likely to spread outside the prostate itself. But until you have a PSMA PET scan performed, we can't say that your disease is metastatic based on just the Gleason score alone. What you can expect when you get a PSMA PET scan is very similar to a CAT scan. So only big difference is that when you arrive to have the scan done, you will receive that tracer and you'll need to wait usually about an hour before they can actually perform the scan to ensure that that tracer has circulated throughout your whole system. But otherwise, the PET scan is very similar to a CAT scan in terms of duration. Sometimes you can feel a little bit of a dry mouth during the scan itself because of the tracer. But otherwise it's a very well-tolerated test, and you only need to be able to lay down for approximately 15 to 20 minutes. So once you have the PSMA PET scan results, they will be reviewed with your provider, and we will be able to know whether or not your prostate cancer is organ confined, meaning only found in your prostate, versus whether or not it's spread outside of the gland. Now, the two most common areas prostate cancer likes to travel to when it does are the lymph nodes and the bones. So those are the areas in your body that we pay very close attention to on the scan. Generally speaking, once you have your pathology results back and you've had a PSMA PET scan, you will meet with your physician to discuss next steps in terms of treatment, whether that be surgery, radiation, and if you will be recommended for any sort of medications for your prostate cancer management.